everyone, happy evening, a very good evening. I hope and I believe all of you are doing well. I hope I'm audible and visible. Just give me a quick nod whether I'm audible and visible. Hi, okay. So, Dr. Taylor's how to go with your plan plus live classes on Unacademy. So, I think you need to strike a balance. So, maybe you can save some time of the day for watching the sessions. You can watch them live or you can watch them recorded as well if you miss the live classes. So, I think you would be the best person to decide how you want to manage the time. Or what you can do is you can just shuffle the timetable here and there. You can make the timetable according to the batch that you are following on Unacademy, and you can change the sequence of the subjects that you are seeing. All right. Okay. So hello everyone. Welcome to this new series called the Study With Me series. We have 4 classes in this series. It is November 15, 16, 17, 18. That is starting today, 8 p.m. daily. Starting today, we will have 4 sessions. The first session that we are going to discuss today is the whiteout and blackout lungs. Okay, so very important. The basic black and white concept of radiology, the X-ray is and CT is what we are trying to decode in this session, so that you can solve any question. This session is going to be useful for the undergraduate students as well, because this is very frequently asked in the practical examinations also, and also for the students appearing for NEET PG, FMGE or any exam. Very important. Once these sessions are done, after June 18, you will have a test on Friday, that is November 19. We will have a test at 9 p.m. on the Unacademy app based on these topics. That is a test that I myself have curated for you guys. It's a test of approximately 25 MCQs based on these 4 topics. What are the 4 topics that we have decided to do here is the whiteout and blackout lungs. Neurocutaneous syndromes is what we would be seeing tomorrow at 8 p.m. in detail in an integrated fashion, the clinical also and the radiological also, including pathology. So basically integrated manner we are going to learn the clinical integrated radiology, which has now become very important. We have seen in NEET PG also, we have seen in INICT also. Then we will have the next class on MRI sequences. Last INICT exam we had a question on SWI MRI sequence. So I'll try and simplify that topic, which seems to be like a mammoth, a difficult task. I'll simplify it for you, the MRI sequences. And then the last would be arthritis in an integrated fashion, including radiology, orthopedics, medicine, pharmacology. All of that we will integrate. And then on Friday 9 p.m. you will have the test on Unacademy app. The link for the test is given in the description. It will be given in the description of these videos. And if you get the top 3 ranks, you get some amazing Amazon gift vouchers for the top 3 rankers of the test. And while enrolling for the test or giving the test, if you are asked for a code, you can use the code Dr. Nikita Live while enrolling or appearing for the test. These are free tests for everyone, right? So we have 4 sessions starting today. This is the new timetable that we just discussed in the today's NEET PG 2022 strategy class, which we had at 5 p.m. on the app. So everyone who's preparing for NEET PG 2022, you can join our group and you can follow these daily targets. So tomorrow we are starting with anatomy. The target for you is to complete anatomy in the next 5 days. Okay, so starting on 16th, I've given you the daily targets also. Tomorrow you have to complete reading embryology and general anatomy. In accordance with this daily targets, we will have the classes at 5 p.m. on the Unacademy app, which are going to be the free classes. So tomorrow we will have embryology Kaun Banega MD episode, that is basically a free live quiz. So what's the plan for tomorrow? Let me tell you that. 11 a.m. we have a class on FMG strategy for 2022 students. How you should plan your timetable, how you should be studying. That's a free live class. 2:30 p.m. the part 2 of GI radiology. It is for the plus subscribers. We'll see the hepatobiliary pancreatic radiology. 5 p.m. in accordance with a new timetable, a free class on the app. All these are going to be on the app. And 8 p.m. on the YouTube channel, the Study With Me episode 2, neurocutaneous syndromes. Very, very important topic. Integrated fashion is what we are going to learn. Neurocutaneous syndromes. Alright. The plus and iconic, I'm sure we all know. Let me tell you about the new batches that are going to start, and these are the test plan that you have for the month of November. This is where you have on 19th Friday 9 p.m. you have the test, okay, on the Study With Me, the 4 topics that we are discussing in these upcoming 4 days. Alright, and this is the rest of the timetable that you have. These are the new batches for FMG 2022 students starting on 17th of November. And there's also a fast track MCQ batch. If you want to do fast track revision with MCQs, a new batch is starting on 17th November. It will be completed by February. Everything would be covered, all 19 subjects. And for 2023 students, we are starting integrated system wise batch. Okay, so all these new batches are starting on 17th of November. Timely start of the preparation will definitely help you in your exams, right? And whenever you are subscribing to the platform, for additional discount, you can use the code Dr. Nikita Live, whether you are taking plus or iconic. By using the code, you'll get extra 10% discount. Alright. So let's start with the first one here. Okay, the concept of black and white of radiology. The first thing that I want to discuss, very, very basic, but not many of us are very comfortable with this, the black and white of radiology. Alright. I hope I'm audible and visible to everyone. I think the stream got stopped suddenly. Please go back to the link and rejoin if this has stopped. The stream has stopped. Okay, that's great. So let's look at the black and white concept of radiology first. Is there some problem with the stream, guys? I'm not able to see it very properly. Okay, so look at the 3 conditions. This is the easiest way to understand the black and white of radiology. Now, look at the 3 conditions here. As you see here, in the first one, the jar is filled with air. Okay, so in the first one, the jar is filled with air. Then we have the second one, where the jar is filled with fluid. And the third one, where you have the most dense, the strongest thing in the body, that is the bone, the skull bone. Now, when you see that when we take a X-ray image, a radiograph, what do we see is, in the first one, which is containing air, the number of X-rays passing through air as compared to the rest of the 2, will it be less or will it be more? How would be the number of X-rays passing? Will it be less or will it be more? Absolutely right. The number of X-rays passing would be more. And that is why you see here that how is the image of the air on X-ray? Air is black. So the more the number of X-rays passing, the image becomes more black. Look at the second one where you have fluid. Fluid is more dense as compared to air. The number of X-rays passing would be less, and that is why the image is less black. Okay, the image is less black. That means it is more towards gray. Okay, it is towards gray. And the last one, where we have the bone, the number of X-rays passing would be minimum. Right, the X-ray transmission would be minimum. You have the image which is white. Right, the image which is white. So what do we conclude out of this? The lesser the density. Okay, the lesser the density, how is the image? The image is more black or the image is more white? If the density of the substance is less, how is the image? The image is black or the image is white? Less dense means we are talking about air, and we know that air is black. Okay, the air is black. The more the density, that is like bones, the white is the image. Okay, the white is the image. Right? If I ask you a question from general radiology, if you get a question, Which of the following shows maximum attenuation of X-rays? Air, water or bones? Which of the following shows maximum attenuation of X-rays? Air, water or bones? What will be the answer? Right. So yes, Sri Lalita, it is bones, it is not air. Remember that by attenuation, attenuate karna matlab kam karna. That means blocking the X-rays. So maximum attenuation, that means maximum X-ray blockage will be seen with bones. Okay, so remember it is bones which will show maximum attenuation. Okay, which will show maximum attenuation. So do you remember this? Based on attenuation of X-rays in the CT scan, we have something called as HU value, right? If I ask you about the HU value of air, water and bones, which one has maximum HU value? Bones have maximum HU value out of this. Water का 0 होता है, air का negative होता है, right? So the HU value depends on the attenuation of the X-rays by the substance. Okay. So now if I tell you that air is black on X-ray, on radiograph, and I ask you on CT scan, how would air be? On CT scan, how would air be? Air will be black or air will be white on CT scan? What do you think? If air is black on radiograph, how would air be on CT scan? So please remember on CT scan as well, air will be black. Why? Because radiograph, that is X-ray, and CT scan are based on the same principle. That means both of them utilize X-rays. Radiography and CT scan, both of them utilize X-rays. So please understand these basics. CT scan is nothing but a three-dimensional radiography. It's a X-ray only. So what looks black on radiograph will look black on CT. What looks white on a radiograph will look white on CT. So if I ask you about calcification, how will calcification appear on X-ray and on CT scan? How will calcification appear on X-ray and CT scan? So we are discussing the very, very basic concepts that will help you a lot of questions to be solved. Right, calcification is dense, it is like bones, so it will look white. Same on X-ray and CT, it has the same appearance. It will be white on both radiograph and CT scan as well. Okay, so white on X-ray is basically opaque, white on CT is hyperdense, right? Now if I ask you on X-ray, on radiograph, how will consolidation look like on radiograph? Will it be white or will it be black? How will consolidation look like on radiograph? Will it be white or will it be black? Absolutely right. Consolidation will be more white. Why will consolidation be white? Whenever you are replacing the air of the lung with something more dense, that is when it will become white. Because air is less dense, more dense means it will go towards white. So consolidation basically means it could be pneumonia, it could be pulmonary edema, it could be malignancy, it could be pulmonary hemorrhage, anything which is more dense than air, it is white, right? And if I ask you, how will collapse look like on radiograph? Collapse कैसा दिखेगा radiograph पे? Will it be white or will it be black? How will be collapse? Collapse is white or collapse is black? Just give me a minute. I'm not able to see the live chat. I'm not able to see your comments. Okay, so this is where majority of us tend to make a mistake. Now remember what is collapse. Collapse मतलब कि जो lung का air है, that is withdrawn away. That is why the lung is becoming collapsed. So that means you have removed the black air and that is why the black is removed. When there is no black, that means it is white. So please remember that both the consolidation and collapse will look white on X-ray, and so would be on CT scan. X-ray and CT, they have the similar appearance. So how do you differentiate whether this is consolidation or this is collapse? If both of them are white, then based on what will you differentiate? Whether this is consolidation or this is collapse. How will you differentiate? So it is based on the shift of the structures, okay, the shift of the surrounding structures, right? So shift of the surrounding structures, where is the shift of the structures in consolidation? Where is the shift of the structures in collapse? If there is consolidation, absolutely right, Sri Lalita, it is in consolidation. Please remember there is no shift of the structures, very, very important, okay? So in consolidation, there is no shift, okay? There is no shift at all in consolidation. While in collapse, because the collapse is a volume loss, it causes same-sided shift, okay? It causes same-sided shift. It causes a pull on the structures, okay? It causes a pull on the structures because there is volume loss. So remember, it's not only the tracheal shift, we look for tracheal shift, the mediastinal shift, the heart shift. If it is lobar consolidation or lobar collapse, we look for the fissural shift, okay? The fissure which separates the lobes of the lungs, if that is shifted or not, that is what we also look for, okay? So remember these very, very important points. So now if I ask you, what do you think? Now coming to the topic of whiteout hemithorax. Okay, coming to the topic of whiteout hemithorax. What do you think would be the causes of whiteout hemithorax? That means one hemithorax is completely white. So whatever looks white, that is consolidation. The four major causes that we need to know: consolidation, collapse, because both of them are white. How about pleural effusion? Will it be white or will it be black? Pleural effusion, matlab pani, which is more dense than air. That means it will be white. It is more dense than air. So pleural effusion, white out. And also remember pneumonectomy. That means complete lung removal, generally done for lung malignancy. So when you are removing the lung, that means you are removing the air. That will lead to whiteout hemithorax. So remember, pneumonectomy is also whiteout hemithorax. How do we differentiate this? Based on the shift of the structures. Consolidation, there is no shift. In collapse, there is same side shift. That means it pulls the structures. How about pleural effusion? Pleural effusion, space occupying, it causes the push of the structures, opposite side shift. It pushes the structures, that means opposite side. How about pneumonectomy? Pneumonectomy is same side or opposite side. What is pneumonectomy? Same side or opposite side? Pneumonectomy would be same side or opposite side. What do you think? Pneumonectomy would be same side. Why? Because pneumonectomy again means volume loss. So that free space, the empty space which is there, it will cause same side. So if you see here, collapse and pneumonectomy, they will cause the shift of the structures to the same side. So how will you differentiate the two? How will you differentiate the two? Because both collapse and pneumonectomy, they cause shift to the same side. So collapse versus pneumonectomy, both cause shift to the same side. So how will we differentiate? Yes. Please remember that radiology is not only photography, that you look at the images and you give a diagnosis. It has to be clinically correlated. So in pneumonectomy, of course, there would be the past history of surgery. The patient will tell you, the file will tell you that the patient has undergone a surgery. So that is why it's very important to look at the file of the patient to ask history to the patient. Plus in pneumonectomy, on the radiograph, you will see some surgical clips that are used. You will see a part of a rib which is removed for pneumonectomy. So all those changes will also be seen. Okay, so That is what we have to okay, remember. Now coming to the images, okay, look at these images. This is how, my first question to you here, this is a radiograph. Do you think this is normally placed या फिर ये उल्टा रखा हुआ है? ये normal है कि ये उल्टा है? If I give you this radiograph, will you put it like this only or will you invert it and put? So very basic question for the undergraduate students as well. You'll be asked in the practical exams. ये सीधा है कि उल्टा है? Please remember, ये सीधा है, ये उल्टा नहीं है. What you need to look at when you are viewing at the radiograph, the L which is placed here, be it सीधा or be it ulta, it has to be on the left side of the patient. That means your right side. In radiology, your right is the patient's left. So this is normal. L सीधा हो या L उल्टा हो, उससे फर्क नहीं पड़ता है. Or you have to look at the R marking which is on your left. That means the patient's right. R सीधा, R उल्टा does not make a difference. Now both of these are normal radiographs. Okay. Look at the black lungs. Look at the white bones because of the calcium. Look at the comparatively more dense, more white image of the heart because it contains the blood. So that you can look at the trachea, the black color because it contains air. So black is air. This is also normal radiograph. Look at the lung appearance. So sometimes the lungs will look very black. Sometimes the lungs will look comparatively more white. You just have to compare the symmetry कि दोनों equally black है, equally white है. Because the black and white appearance depends on the technical parameters also. The KVP, the MAS, कितने पे ले रहे हैं, that also affect the black and white appearance. Okay. So this is the normal radiograph. So we have already discussed this. A complete whiteout causes are pleural effusion, pneumonectomy, collapse and consolidation. Okay. Now I am giving you these images and I am labeling this as A, B, C and D. And I ask you which of the following images represents your pleural effusion. Which of the following images represents pleural effusion? Okay, so life in great moment for first year, because in anatomy you have radiological images. I would advise that watch the general radiology part to understand CT, MRI, X-ray, all of that, and then watch the starting of each system where I have discussed the anatomy. Which of these represents pleural effusion? So when I say pleural effusion, what you need to look at is the shift of the trachea to the opposite side. Okay, the opposite side shift. In which of the image the trachea is shifting to opposite side? It is the image B. Look at the trachea here. Look at the trachea here, deviated. This is pushing the trachea to the opposite side. So that is pleural effusion. If I ask you which of these is representing consolidation? Which of these is representing consolidation? Consolidation means no shift, trachea in the center like you see here. So that is consolidation, which has no shift. Okay, consolidation has no shift. If you look at the image C, in the image C, tell me where is the shift of the trachea? Same side or opposite side as compared to whiteout hemithorax? Is it same side or opposite side? Where is the shift of the trachea? You can see that this is the whiteout hemithorax. You can see the trachea is deviated to the same side. So that means it is same sided deviation. The trachea is also shifted as the same side. Okay. And in the image D also, you can see that this is whiteout hemithorax and the trachea is deviated to the same side. So C and D basically have the tracheal shift to the same side. So the causes could be collapse or pneumonectomy. I'll show you more detailed images on how to differentiate. It could be collapse or pneumonectomy. Okay. Now look at this image, image A and image B. What do you think is the image A showing? This is very, very important for FMGE exam or any exam. Very, very important. What do you think is the diagnosis in the image A and what do you think is the diagnosis in image B? This is not a whiteout hemithorax for sure, but only this part is whiteout, only this part is whiteout, not the entire hemithorax. Absolutely right. So what do we see in the image A is basically that this entire thing is white and this is the fissure. Okay, this is the horizontal fissure. So above the horizontal fissure, this is the right upper lobe. The fissure is in its normal position, horizontal. So no fissural shift. So this is consolidation. Above the horizontal fissure, this is right upper lobe. What do we see here? This white color is limited by this fissure. The fissure should have been here horizontal. This fissure is pulled up, right? The opacity is pulling the fissure towards it. So that means this is right upper lobe collapse. Okay, this is right upper lobe collapse. This is how we differentiate. Okay, so you have consolidation and collapse. Okay, now look at this one. What are you seeing in this image? Any particular sign that you are seeing in this image? Very good, Orchid, absolutely right. So we are seeing a sign here which is called as air bronchogram sign. Very, very important again and frequently asked. Air bronchogram sign. So what is the air bronchogram sign? So here we see the white lung and through that we see this black bronchi. This is the white opacification of the lung and we see the black bronchi. So this is air bronchogram. So basically you see the bronchi containing air, they are black. So it is air bronchogram sign. What does the air bronchogram sign indicate? What does the air bronchogram sign indicate? See, so now if I ask you, normally bhi to bronchi contain air, no? Like normally also the bronchi which are there in the lungs, they contain air. But we do not see the bronchi very commonly. Right, we don't see the bronchi normally. Why? Because the lungs and the bronchi, okay, the normal lungs and the normal bronchi, both are air containing and they are black. So black or black, they merge together. You know, it's like an example of a group of Negroes. Everyone black, everyone looks the same. Now in that group of Negroes, if I put a very fair person, like a very, very fair person, that fair person will stand out in that group. So basically radiology is all about black and white contrast. In the group of black, if you put a white, it stands out. In the group of white, if you put black, it stands out. So what happens in consolidation? The lung parenchyma becomes white. The alveoli, they are filled with more dense thing, so they become white, but the bronchi are still black. So what happens in consolidation? As you can see here, the white lungs and the black bronchi, they stand out. They are opposite colors. So the black bronchi, they stand out in the white background of the lung. क्योंकि यहाँ पे अभी lung पूरे white हो गए. So the black bronchi, they become prominent. Okay, the black bronchi, they become prominent. So where do you see the air bronchogram sign? What are the criteria for air bronchogram? First, it is the lung parenchyma which should become white. It is the alveoli, the lung parenchyma which should become white, plus the bronchi should contain air. That means the bronchi should be patent. They should be black. So basically for air bronchogram, we want the white lung and we want the black bronchi. So if I ask you whether you will see air bronchogram sign in pleural effusion, yes or no. So if I tell you that there is a whiteout hemithorax and the cause is pleural effusion, will you see the air bronchogram sign? Will the air bronchogram sign be seen in pleural effusion? No, right? Why no? Because the whiteout here is not because of the lung becoming white, it is because of the pleural effusion, the surrounding pleural space containing fluid. That looks like whiteout. The lung is still black, the bronchi are still black. So there is no black and white contrast. So pleural effusion will not give an air bronchogram sign. Okay, so remember this very, very important point. If I ask you a sign to differentiate whether this is parenchymal pathology or whether this is a pleural pathology, extra parenchymal or pleural pathology, we can use the air bronchogram sign. Okay, so air bronchogram sign will be seen in parenchymal or pleural. It will be seen in parenchymal pathology. Okay, because the lung parenchyma has to become white to show the air bronchogram. Okay, so this is very important point to be remembered. So in this case, where I see the air bronchogram, I know that the white color is because of the parenchymal pathology, most commonly consolidation. So anything where the lung becomes white, pulmonary edema, pulmonary hemorrhage, or respiratory distress syndrome, where the white is because of the lung parenchyma, that will show the air bronchogram sign. Okay, that will show the air bronchogram sign. Now look at this one, very important image again. What do we see here? This is the white appearance of the lung. This is the normal lung. And through this white lung, we see the black bronchi going, right? We see the black bronchi going. So this is air bronchogram sign, which tells you that this is a parenchymal pathology. Okay, this is a parenchymal pathology. This is not extra parenchymal pathology. Okay, the air bronchogram sign. Okay, now coming to few images, your assessment time. Tell me what is the cause of whiteout hemithorax in this patient. What do you think is the cause of whiteout hemithorax in this patient? Is it consolidation, collapse, pneumonectomy, pleural effusion? What do you think? Very good, Rutvi. Absolutely right, Dr. Darshana. This is pleural effusion. Why is it pleural effusion? Because you look at the trachea is deviated to the opposite side. It's a mass effect. Trachea shift to opposite side. So that tells you this is pleural effusion. Look at this image very carefully. Are you seeing the air bronchogram? No. So there is absent air bronchogram sign that you are seeing. So this is not a parenchymal pathology. Next one. What do you think is the cause of comparatively like nearly whiteout hemithorax in this patient? What do you think is the cause of whiteout in this patient? Is it consolidation, collapse? Is it pleural effusion? Is it pneumonectomy? What do you think? Yes, this is consolidation. So where you see this patchy opacities, right? There is no shift of the trachea. You can see the trachea is in the center. You can see this black areas, the black bronchi going through it, air bronchogram, patchy opacities, no shift. All of this tells you that this is consolidation. Okay, all of this tells you that this is consolidation. So the cause here is consolidation. All right, what is this image showing here? If I zoom this image for you so that you are able to see it better, this is showing air bronchogram. So again, consolidation. Okay, this is air bronchogram, consolidation. Okay, look at this one, a bit difficult to pick up. At least tell me the cause that you think in this patient of the left whiteout hemithorax. What do you think? How to differentiate ARDS? So Rutvi, ARDS, basically it's your acute respiratory distress syndrome. It is bilateral symmetrical opacities is what you would see. Okay, it is defined by your parameters as well, right? And it is bilateral symmetrical opacities that you should look for. Yes, so it is either collapse or pneumonectomy, because you can see here this trachea, the black color, it is deviated to the same side. So this is either collapse or this is pneumonectomy. If I zoom this image for you and if you see very carefully, there are some white surgical clips that you would be able to see here. Difficult to pick up, but there are these surgical clips that tell you that this is pneumonectomy. Okay, this is pneumonectomy. All right. This is very interesting and I want to see who gets this right. What do you think is the cause of whiteout hemithorax in this patient? So interesting, radiology sometimes can trap you, but this is very important to understand. Yes. So something which looks like consolidation, but actually this is not consolidation. Why this is not consolidation? Everything is right. You see the trachea in the center. Okay, there is whiteout without tracheal shift. But this is not consolidation because there is no air bronchogram which you see here. Look at the radiograph. This is a supine radiograph. So in mild pleural effusion, when the patient is supine, that entire fluid will gravitate down. And when you will take the X-ray in the supine position, the AP view, that fluid gravitating, that will give you the whiteout hemithorax. The absence of air bronchogram tells you that this is not consolidation. Rather think of pleural effusion. Okay, rather think of pleural effusion. So this is important here. Supine radiograph, pleural effusion, mild also can give the whiteout. Okay, so very, very important learning, which generally, traps us. So radiology has a lot of understanding that we need to have. Okay, now look at this one. What is this image showing? What syndrome is this? Very good, Tamim. Absolutely right. So that is Poland syndrome. Okay, the Poland syndrome. You see the chest wall, absent pectoralis muscle. You see the syndactyly, that is Poland syndrome. And if I ask you, when you take a chest radiograph of this patient, what will it show? Right whiteout hemithorax, left whiteout hemithorax, right blackout hemithorax, or left blackout hemithorax? What do you think will this show? When I take a chest radiograph in this patient, what will I see? Right or left, whiteout or blackout? Vishnu Priya says left whiteout. Left whiteout. I don't know why all of you think it is left whiteout, because we were discussing the topic of whiteout. No. So this will basically show left. It will show left blackout hemithorax. It will show left blackout hemithorax. Why? This will show left blackout hemithorax basically when you are taking a chest radiograph. Okay. So imagine that this is the chest wall, and then you have the lung. Okay. So the chest wall structures, like you have the muscles, the breast shadow and everything. So when the X-rays are passing through the patient, they have to pass through the chest wall. Okay, they have to pass through the chest wall and then they reach the lung. So what happens is, when you are taking a chest radiograph, if you remove this density, the chest wall structures, so the density through which the X-rays are passing is decreased. So the number of X-rays which are attenuated, which are blocked, are also decreased, right? Basically, the number of X-rays reaching the lungs and passing through the lungs would be more. And when we just saw in the first slide, when the number of X-rays passing through a structure is more, like air, that structure will look black. So basically the increased X-ray transmission will give the black appearance. So when you decrease the density, right, we discussed this, when you decrease the density like air, that appears more black. This is what you are doing on this side, on the left side. This is the left side of the patient. So the left side, decreased density, that means the left side will appear more black. Okay, is this clear with everyone? So remember, Poland syndrome is a cause of hyperlucent lung. Black matlab lucent. Okay, lucent matlab transmit karne wala. So that will be hyperlucent lung. So now we are coming to the causes of unilateral hypertranslucent hemithorax. Translucent means black hemithorax. Whiteout देख लिया, अभी blackout देखते हैं, ठीक है? So to understand the causes of blackout hemithorax, what do we need to know? Coming back to the basic concepts in radiology, okay? So what do we need to know is, for blackout hemithorax, okay, the blackout hemithorax, what looks black on X-ray or CT? What looks black on X-ray or CT? Air, right? It is air. So whenever you will have increased air, that will give blackout. When will you have increased air? It could be pneumothorax, right? It could be pneumothorax. It could be emphysema, though it will not be unilateral, it's generally bilateral, but the lungs would be more black. So pneumothorax, emphysema, if you have a giant emphysematous bulla, all of that will give black. Okay, all of that will give blackout. Second, increased density or decreased density will give black appearance. Air zyada, matlab air decreased density. So when you decrease the density of the overlying structures, that will give blackout hemithorax. So like when you remove the pectoralis, chest wall density kam kiya. So Poland syndrome, congenital absence of pectoralis muscle. Then you have mastectomy. If a patient has undergone mastectomy, the density is decreased, so that will appear black. Like you have poliomyelitis, the muscles are less in the bulk. So decreased density, that will give the blackout hemithorax, hypertranslucent, right? So increased air, decreased density. If I ask you about vascular markings, what will give blackout? Increased vascular markings or decreased vascular markings? What will give a blackout hemithorax? Increased or decreased? What will give the blackout? Is it increased vascular markings or decreased vascular markings? So for that we need to understand that vascular markings are white or black. Vascular markings मतलब blood, मतलब dense, मतलब white. So जब आप white वाला thing निकालोगे, कम करोगे, that will become black. So decreased vascular markings, okay, decreased vascular markings will give you black appearance because you are removing white. And when will we have decreased vascular markings? When there is pulmonary embolism, right? Embolism, that means decreased blood supply, so the lung will become more black. Do you remember the sign that we see? That focal oligemia in pulmonary embolism. What is that chest x-ray sign called as? If you compare the right and the left, if this is the area of embolism, this is more black as compared to the opposite side. What sign is it called as? Decreased vascular mark. Vascular mark is Westermark, right? That is called as Westermark sign, not the Pala sign. Pala is enlarged pulmonary artery. This is Westermark sign. So remember, oligemia, that is decreased blood supply, will give black appearance. Okay, will give black appearance. Then the next cause could be your technical cause. Okay, the technical cause. What could be the technical cause? Rotation of the patient. If the patient is not standing straight, while taking the radiograph, if the patient is rotated, so one side is more close, that means away from the X-ray tube, and one side is close to the X-ray tube. So that the change in the distance of the two sides affects the appearance of the lung. So rotation will affect. Also if the patient has scoliosis, so because of the scoliosis, aage piche lungs, that will have one white lung and one black. So all these are the important causes of blackout hemithorax. When we spoke about increased air, remember that when do we have increased air in the lungs? Obstructive lung pathology or restrictive lung pathology? It is the obstructive lung pathology which traps the air. Okay, which traps the air. So your obstructive lung pathology, like in children, very common. In a child, after viral infection, viral LRTI, mycoplasma LRTI, one lung is destroyed. Okay, there is post-infectious obliterative bronchiolitis. Okay, post-infectious obliterative bronchiolitis means the bronchi are inflamed and obstructed. Obstructive lung disease, air trapping, that is something called as Swyer-James syndrome. You must have read in pediatrics, important question. Okay, the Swyer-James syndrome. Swyer-James syndrome, also called as McLeod syndrome. You will see that one lung is small in size, the volume is less, it is more black, the blood supply is less. That is Swyer-James syndrome, important question in pediatrics. Okay, so in rotation, which side is more black? The side which is close to the X-ray tube, that will receive more X-rays and that will be more black. Okay, the which is close to the X-ray tube, that will be more black. So let us have a look at the causes here. Now in this image, if I ask you, do you see the difference in the appearance of the two sides? Which side is appearing more black, the right side or the left side? Which side is appearing more black, the right or the left? And what do you think is the cause? Absolutely right. The left side is appearing more black, very correct. On the right side, you can see this breast shadow. On the left side, the breast shadow is not there. So look at this increased density, breast shadow, increased density. This is more white. This is more black because the breast shadow has been removed. There is left mastectomy. Very, very important to pick up. So this is a patient with left mastectomy. Right, so you can be asked in your practicals as well. Identify what do you think is the primary pathology in this patient. Breast cancer के लिए operated. What do you think is this image showing? The arrow has been put already. Look at the arrow. So things made easy for you. What do you think is this? Look at the arrow. Is the arrow pointing to pulmonary artery? No. Very good. Dr. Darshana, Aishwarya, absolutely right. So you can see here on the right side, this is the right side of the patient, this is the left side. On the right side, you see this chest wall muscle, pectoralis, anterior chest wall muscle. This chest wall muscle is absent here. So there is absent pectoralis muscle. So this is Poland syndrome. Okay, this is Poland syndrome. Why don't we see the white and black difference? Because this is not the lung window. Okay, not the lung window. Look at this one. Now you will see the difference in the white and black appearance. What do you think is the cause of the white? Okay, you can see the right side is blackout more as compared to the left side. What do you think is the cause? Again, it is Poland syndrome. Look at this muscle which is present on the left side. Look at the absent muscle here. There is asymmetry. And look at the more black appearance of the right side. So this is Poland syndrome again. Okay, this is Poland syndrome. The right side appearing more black because of the decreased density. Okay. If I tell you that this is an X-ray of a child and post-viral infection, the patient has dyspnea, all of that, what will you think of? In a child, it is Swyer-James syndrome, also called as McLeod syndrome. Which side is more black here? It is the left side which is more black. Okay, the left side is more black. That is post-infectious obliterative bronchiolitis. Absolutely right. So that is Swyer-James. Because of the obliterative bronchiolitis, there is air trapping and that is why it is more black. Okay, that is why it is more black. So this is the mnemonic. Across is the mnemonic for your unilateral hypertranslucent hemithorax. That is the black hemithorax. One A for air, so pneumothorax. A for artery, pulmonary aplasia or hypoplasia, the decreased blood supply. C for chest wall, mastectomy, polio, Poland syndrome. R for rotated film. O for obstructive causes, airway obstruction, foreign body, emphysema, even large embolus obstruction in the vessel. S for scoliosis, S for Swyer-James or McLeod syndrome. Okay, these are the causes. So what do you think would be the answer to this? Hypertranslucent chest X-ray is seen in all of the following except PIOB, post-infectious obliterative bronchiolitis, Rekha, right? Hypertranslucent chest X-ray is seen in all of the following except, absolutely right. Very, very important, pneumonectomy. Pneumonectomy rather gives whiteout hemithorax with same side shift or opposite side shift. Same side shift or opposite side shift. What does pneumonectomy give? Whiteout hemithorax with pneumonectomy, lung removed, there is volume loss. Volume loss pulls the structures. Volume loss will pull the structures like fibrosis. So there is same sided shift. Okay, there is same sided shift. It will pull the structures. Okay, so that is blackout hemithorax. Right. So yes, that was about the discussion of the today's whiteout and blackout. I basically wanted to clear the concept. Consolidation, collapse, pleural effusion, how do you differentiate, blackout, what are the causes, Rather than just mugging up the causes, it's easy if you understand the concept and remember the causes. Okay, so this was the episode 1 in Study With Me series. Tomorrow 8 p.m. we will have neurocutaneous syndromes, very interesting topic, integrated manner, pediatrics, radiology, pathology integrated. And do not forget, on Friday you will have the test on these topics. The link is given in the description. Enroll for the test. If asked for the code, use the code Dr. Nikita Live. And the plan for tomorrow classes I've already shared. 11 a.m. FMG strategy, how you should prepare for the exam. 2:30 p.m. plus class GI radiology for the subscribers. 5 p.m. free live class Kaun Banega MD, an interesting live quiz with leaderboard on embryology, considering the daily targets that you are starting with tomorrow. And 8 p.m. I'll meet on YouTube channel with neurocutaneous syndromes. Okay, so I hope all of you have understood the concepts. The black and white has been decoded. This will help you solve many questions if you understand the black and white concept, basically decreased density, increased density, all of that. So thank you so much for being here and for hearing me out, for your patience. That means a lot to me, and I'll see you again tomorrow. Till then, goodbye, take care, keep studying, keep revising, and keep winning. Thank you so much.